taught me my work ethic. My mom taught me to look after the widow and the orphan. What the Bible calls true religion. And it took a while for me to figure out what that really looked like, but I feel like I am definitely a product of them, both I think physically and spiritually. I feel like I've gained a lot of their strength. So Charles told you a little bit about my training history. I'm kind of unique. From the age of a 5-, 6-year-old boy, I knew I wanted to be a pediatrician, and shortly after that, I knew I wanted to be a medical missionary. That's what we called it back then. Now we call it a global health specialist or something like that, or PR. But I knew that very, very young, and it's probably because I had this really cool pediatrician that was a global health specialist that saved my life from typhoid fever. And nobody could figure out what I had except for this guy that just happened to work in the Peace Corps. And that was, to me, really cool that that guy knew more than the people that were trained in the best places in the world. And so that was really probably the beginning of that desire to really want to be involved in global health. So throughout medical school, this is my daughter Avery, everywhere in a what's now considered illegal and child abuse cradle board from the Navajo Nation. We didn't leave you in there long, I promise. So we were in Navajo Nation at the end of medical school, and then I went to Romania during my training, spent a month with HIV patients, and time in Mexico, Sri Lanka, and so forth. And so all over the world doing global health projects. What's that say?
Speak into the microphone, please.
Oh. Speaking into the microphone. So all over the world, really getting a chance to see good examples and bad examples of global health. And kind of really fell in love with it, but hoped I would get to do it more on a sustainable basis and not just once in a while, every 2-3 years, a nice project. But kind of life caught up with me, and after 10, 15 years in medical education, teaching, running training programs, I realized, hey, I've kind of lost that ability to do that. I'm just not able to do it anymore. And as I moved here to Austin and had this, what looks to be and really is a perfect family, I felt like I kind of lost control of that side of my life that I really wanted to get back involved in it. I just frankly didn't have any avenues to do it. And then, little guy, it's in the back of the room right there, showed up in our lives. And Comerson was abandoned in a market in Haiti. Around that time, my wife and I really felt called to adopt. And so we didn't know where, but over months, we figured out it was going to be in Haiti. And over months, we finally got to see him, but he was quite ill, it turns out, when we started the process, and he was really found to be our child. And my history being an infectious disease doctor, I basically told the folks in Haiti, I want someone that makes sense for me in terms of my training. I'd like to have someone that has infectious diseases, if that's possible, that are considered in Haiti really difficult or not possible to take care of. And so they tied him up with us in what was one of those great things in fate. And Comerson is HIV positive and had tuberculosis. And so two things that 20 years ago he had no hope, but he absolutely is as healthy as you can be. He has no detection of the HIV in his body, and his TB is wiped out. And it's all because of efforts of folks like our next speaker and what they've done in these kind of countries to try and get basic medical needs taken care of. So we were starting in this process of trying to adopt this guy, but when they found him, he's really near death. He was 3 months old, probably had PCP pneumonia, was about to die, and frankly, they couldn't even find a hospital willing to take him until someone like me that is in Haiti decided just that no is not going to be an option. Basically broke down the door of the hospital to get him in, and he started to get care, and he started to get better, and really, within a year, he was back on target to where he needed to be. So while this was all going on, I start getting phone calls from folks about this kid. And this guy, Franski, lives in a totally different part of Haiti. He's a special needs child. Special needs showing Haitians that these kids have value. And it's made a profound impact in the lives of the community that we're in. It's a small village called Nepali. There's about 3,000 kids there, and this little guy just happened to get a falciparum-resistant malaria, which is one of the bad guys. Haiti doesn't acknowledge that it exists because it's too expensive to take care of, and so they kept trying standard treatment, and he kept failing. And after about 50 days of fever and seizures, he was basically on his deathbed when someone called me from this place that knew me from pharmaceutical research I'd done 10 years ago. And I basically did some research, and within 10 minutes I found, oh, you know what, there's a little bit of a cover-up going on in Haiti, and there is some resistance, and you need this drug. And a long trip and process of trying to find the medication led to the fact that it frankly doesn't exist on the island. There's none. They don't want it there because they don't want to acknowledge that it happens. And so, out of that, we literally got someone from the United Nations to fly in $20 worth of medicine on a Learjet into Port-au-Prince to take it to this child, and the child survived. Long, crazy story, but because I just took 10 minutes to basically make that recommendation, this ministry asked me, hey, you want to be the medical director and take over this thing? Like, 10 minutes, and that got me that. But think about where I was. I was in a place where I wanted something like this in my life, and I was really kind of crying out for this sort of opportunity. And it just happened to coincide with when I wanted to start a training program here. So it's perfect timing, because one of my pillars of this fellowship that I run is, it's not one that you would think, it's advocacy. I truly believe that teaching my pediatric emergency medicine fellows advocacy makes them better clinicians, researchers, whatever it may be, because they're passionate about what they're passionate about, right? I don't have to convince them to be passionate about something that I know they care about. It doesn't have to be legislative advocacy, it doesn't have to be global health, it could be injury prevention or whatever it may be. But I really want them involved in that. So I was trying to create avenues for them to get that sort of training experience. And this was the perfect way to do it. So timing-wise, it literally couldn't have been better. But I had no idea what I was doing. And so I started to look for help. And it just turns out one of these guys that I trained 10 years ago in Houston happened to be what I call like the Mother Teresa of Haiti at the time. He runs 4 clinics in Haiti. He's got 5 Haitian children he's adopted. And he was one of my old trainees. And so I called this guy up and said, hey, I want to learn how to take care of people in Haiti better and not just do hit-and-run medical missions, but go and have a sustainable long-term presence there. So he gave me a PhD in Haiti in about a week, taught me that you need to let the Haitians work in the medical system. You don't replace them, you teach them, you train them. And that really resonated with me as an educator. So I said, oh, you nailed that, I got that. So I started getting a lot of my friends involved, but I had to have a Haitian staff. And so we found this nurse practitioner that was literally self-educated, put herself through, and that's unheard of in Haiti. Nobody has funds to pay for school. She got through school somehow, and she really wanted to be our nurse practitioner. So we said, that's it, we're going to train you. And I started sending my fellows down and my trainees down. And so this is one of my trainees that's about to graduate. He has a passion for global health. I said, you know what? I need you, Tim, to go teach Carmela how to do what she can do with limited assets and resources. We're literally, the average amount of money spent per capita in Haiti right now on healthcare is $84 per year. $84. That's less than, a course of antibiotics in children. While, we're spending $10,000 plus in the States on ourselves. So how do you do that is you have to really work within the infrastructure that you have. You have to buy cheaper medications. You have to not do the most expensive tests all the time. And these guys started to teach Carmela how to do that so that she could actually take care of people in a more cost-effective manner. And then, believe it or not, we convinced somebody that makes $40,000 ultrasounds that it would be really nice to get a free one. And we got a grant to bring one down and teach Carmela, who does a lot of midwife work, so she can start doing prenatal care with the ultrasound, which is amazing because there's really like 3 on the whole island, and one of them's in our little village clinic. So that's where I am in terms of the medical presence, and then I just want to say that things have come full circle, and Comerson did make it home. So last month on the 15th, after 3 years of waiting, essentially, we got him home, and he has incorporated into our family quite nicely. Here's his trip home on the airplane. We told him it was a bus, so he wouldn't freak out, but it worked out okay. And when he finally arrives at home, and now very day he was born. So thank you for awarding me this. I really appreciate y'all coming out tonight.